All right. Good morning, everyone. All right, let's get defined today. We're going to do a mastopexy with breast implants, one of our more common procedure. This is a little bit of a challenge. In this particular case, the challenge is the patient has fairly large breasts and it is sagging. You can tell right here, if you look at the numbers, 27.5. That's centimeter. That's the measurement of her nipple position. She's 5'3". So it should be about 20. So this is where her nipple should be. So that's a pretty significant lift. So the challenge is, first of all, she wants to go bigger and she wants full cleavage, right? So we're going to use silicone implants. They're 545 cc and they're going to sit up here nice and high for her to have that full cleavage. So the challenge is when we do the lift, we have to remove all this tissue on the bottom here so that way it doesn't bottom back out. So oftentimes, many people do this separately. They would do the mastopexy first and kind of let everything settle, and then you put the implants 3 months later. It's a little easier because you can tweak it, you can remove little dog ears here and there, and kind of like, kind of make everything just right. But most of my patients, for whatever reason, I just can't convince them to do it separately. They all want to do it at the same time, So it just, the revision rate is a little higher, and the revision really has to do with removing little puckering here and there, because you're removing breast tissue down here, and then you're adding here, and you're trying to get it the same size. So there's a lot going on, and then you're relying on patient's elasticity, how much is it going to stretch, and so there are some factors that are the patient base that we can't control. So it's not 100% predictable. So, patients have to understand, look, if you're going to do it together, maybe a slightly higher chance of having minor revision, and she understands that. So the implant's going to sit underneath the muscle, and it's going to be held by the muscle, and it's a very large implant. So, and then we're trying to reduce the breast tissue down here. So we're shrinking everything, but we can't shrink it too much because then it's not going to accommodate the larger implant. So a little bit of a challenge, but we're going to do just fine. And this side I think is a little bit bigger, so we're going to remove a little bit more breast tissue. Again, this represents, if you haven't seen any of the other video, this is new nipple area position here. When we suture together, her nipple area is going to be right here, and we want to make sure it's nice and small, doesn't spread out, and scars not very noticeable. It takes some time to heal. And this indicates the skin excision. We're only removing the top layer of skin. So we leave the nipple area, which is smaller than this sticker, we leave it attached to this kind of tissue flap. And then we kind of pull it up, but then all the purple markings, that's all the breast tissue that we're removing. So we got to remove a significant amount, So if you don't, then what you see a lot of these people who get breast lift and then they just kind of bottom back out, and then they gotta redo everything. So again, skin removal, tissue removal, and then the pocket, goes right there. And then when you put the implant in, you get the fullness. 545, that's a large size. So we're gonna it's gonna be a little tight. Obviously, when you go with a bigger implant, there's an additional risk. There's a lot of pressure. So when you put pressure, obviously we have to worry about the tissue flap. I don't want to get too technical, but obviously blood supply to the nipple areola is key. If you make it too tight, then it may just decrease too much blood supply, and you put the nipple areola, at risk. So it's a lot going on when you do this kind of procedure, and so you gotta have to balance. If the implant is just way too tight, then I may not take that chance, So sometimes you just gotta kind of get in there and see how things go, and you don't know until you get in there, because how thick her muscle is, how well her pocket's gonna be developed. So, and that's it. And then these green markings, which is we're gonna take some inner thigh. She already has a great waistline, and so you just trying to match her breast with her proportion, and she's ready to go. All right.